How do you treat heel fissures that are cracks in the back of your heel that can be painful, that can snag on your socks? That's what we're going to go over in this episode of Healthy Living. So what you can see here, this is an example of a heel fissure, okay? What a fissure means, it's kind of like a deep crack or a deep crevice. And one of the most common places that this happens is in the back of the heel. You can see this example, there is these deep cracks that are in there, and then there's this callus that's kind of covering it. And this is a problem that females, I would say 90% are females. They have this problem in the summertime, some have it in the wintertime, but the majority of patients have it and they kind of deal with it and they get concerned. So I guess the first question is, how long have you had the symptoms? If it's something that you haven't had that long, it might go away on its own. But if it's something that you notice every winter or every summer, you should probably get it checked out. And what treatments have you tried? What are the things that have helped in the past? I always ask these questions to all my patients before I see them. And then how does it impact your life? If this wasn't impacting you, you know what? You probably wouldn't be watching this video. So it's frustrating to you. It's embarrassing. You want to kind of know what you can do. And there's a lot of other kind of misconceptions and things like that that people say that you can do. I'm going to tell you what really works. I see this every single day in practice with my patients. And then why do you want treatment now? That's kind of the thing. And really the treatments aren't that complex, but you just have to do them. So I'm going to explain them. And one tip, when you're trying to do new treatments, okay, make sure that you make it a habit. And this is something that's key. So you want to do something called habit stacking. So you take something that you already do. Let's say you take a multivitamin every morning. That's when you're going to do these things that I'm talking about, if it relates to like buffing it or pumicing it or putting a cream on it. So let's get into it and look specifically what a heel fissure is. So a heel fissure, you can see this image on the top, it's a crack that's in the back of the heel. It tends to happen in the back of the heel, but if this gets really big, it could actually create a cut. It could create an ulcer or a wound. Some patients even have ulcers in this area if they're diabetic. So it can be very dangerous. Now, if it's not treated, okay, it can be painful when you're standing and walking. It can cause bleeding. Like I said before, it can snag on your sock, which is more of a pain than it is, anything else. And you can be at a risk of developing an infection or a wound if you are a diabetic. So that is a big concern. You want to be careful. Now, I use this dysfunction symptom index to help explain things for a lot of things that I do. So you can see on the bottom, I have the age. So as you get older, you can go over this symptom line and you have to look at, well, what is the dysfunction? Well, I know, heel fissures, this is a very simple thing. What's the dysfunction that can happen? Well, you could have a dysfunction of the type of shoe you're wearing. It could be an open back shoe. You could have dryness. You could go barefoot. You could have diabetes. What's the problem with diabetes? Well, with diabetes, you can have something called autonomic neuropathy. So basically, your sweat glands don't sweat as much, and that could cause a crack or something else like that. You could also have a skin dermatitis, eczema, inflammation of the skin that could cause it. If you're standing for longer periods of time, also that can cause it. And then if you use some type of a harsh soap, what do I mean by a harsh soap? A soap that really, really dries out the back of your heel. That's also something that can happen. So what happens is with patients, if you go over the symptom line, you get the cracks, you do treatment, it goes under the symptom line, and then it may go over the symptom line. Basically, you have to do these things probably the rest of your life. So how long does it take to get better? Well, if you've had this for over 3 months, it might take you 3 months. If you've under 3 months, usually in a month. So what's the process? Moisturize, and then reduce friction and pressure. And we're going to go over that. Now, to begin, I'm going to go over this checklist. Now, I want to just, for you that are just starting to deal with this, I put the first treatments you might want to consider, and I hope you'll stick around a little bit longer. But I put a little asterisk by the things you might want to start with. So you might want to start with an x-ray, a closed back shoe, urea cream, trimming the callus, a pumice stone, a heel cup. But I'm going to go into all of those. Ready, set, right now. Okay. So the first thing to help treat the cause of the dryness is do not wear. See this heel that has an open back? That's the one you should not wear. Okay. Don't wear that one. Wear one with a back that'll help keep the moisture in. This is an example of a cream that I recommend called Cara 42. You don't have to come buy my cream. If you're here, I'll probably offer it to you. What does 42 mean? 42% urea. So you can go anywhere else. I'll put a little link underneath here on Amazon and everything that you could ever think of for cracked calluses, okay, for cracked fissures in the back of your heel. So Cara cream is one. This is the one that we have. Another thing that you could do is a heel moisturizing sock. Basically, this is a sock that has like a gel little cushiony thing in the back, and that you put the cream on and then you put the sock on. Patients always ask, how do I wash it? Well, you just kind of hand wash it, okay? Next thing you can do is something called a ketoconazole cream. This is an antifungal cream that you may want to use, okay? And this is something if you have any athlete's foot. And then you're reducing the calluses. So this is done with a razor blade. You kind of shave them down. That's what it looks like before and after. You can also do pumicing. So I recommend using the cream every day, getting a habit, cream every day. You shave it down with your doctor. You can't do that on your own. Don't get a razor blade. Okay, don't do it on your own. Please, please, please. You could cause bleeding, and then you pumice it. But if you need help, you have to see someone professionally. And then I put this last thing on here, super glue. Okay, if you have a really painful one, you can just put some super glue or some Dermabond or something similar like that. That can kind of close the skin temporarily. Other ways to reduce friction would be this heel cup. This heel cup is really good. All these will be under the Amazon links. That just reduces friction. Another thing that you can use is a custom orthotic. Okay, this is an example of an orthotic that's going to take the pressure off of it. This is a multi-density insert, which is an insert that has 2 different densities, and that can help it. And then finally, this is an orthotic treatment evaluator. You guys can read this on your own. I don't want to go through it, but this just shows the difference between the pros and the cons of a custom orthotic versus a non-custom orthotic. You know, the custom one lasts longer, it's prescribed, it removes the pressure better for posture. You can give a comfort guarantee. It does have some cons to it, but you want to talk to your doctor about that. And then finally, there's something called Glide, which reduces the friction on the bottom of the foot. That can be very helpful as well. And then if you want all of this stuff, I put it in my foot treatment toolkit. So I'll put a couple of links on the side of this video where you can get my foot treatment toolkit and also my shoe buying guide. My patients love that. I'd love to hear your feedback. Please comment underneath this video. And until next time, we'll talk to you more. Thanks.